Hello mamas, this is Bharti. Today we'll be talking about back pain during pregnancy and what you can do to treat or prevent it from happening. As the pregnancy progresses, a lot of changes happen in our body which can lead to pain in the back and the pelvis. First, as the weight of the baby grows, our center of gravity changes and moves forward, which in turn causes the lower back to overextend, leading to pain. Add to this, towards the end of the pregnancy, a hormone called relaxin also kicks in, which basically helps in relaxing the muscles and the ligaments in and around the pelvis area to prepare for delivery. Now, while that is important for you to actually deliver the baby, it causes instability in the area, which can also lead to pain. So it is very important that we work on strengthening the core muscles in the body, which help in keeping the back and the pelvis stable. You can visualize the core as a cylinder in the middle of your body with the diaphragm at the top and the pelvic floor muscles at the bottom and the abdomen and the back muscles in the middle. So we are going to work on strengthening these core group of muscles to bring in more stability during pregnancy. While the exercises that we are going to do are safe for pregnancy, I always recommend that you should take a clearance from your doctor before starting any workout during pregnancy to make sure that they are safe for your particular case. So once you are ready, let's hop onto the mat and get going.
The first exercise is called the pelvic tilts. For this, you roll down sideways and lie down on your back. Fold your knees and bring the soles of the feet on the ground. Keep the feet hip distance apart and hands near the hips. I'll take my arm up so you can see better. Take a deep breath in to relax, and as you exhale, draw your belly in, bringing your belly button towards your spine and closing the gap between the lower back and the ground. Stay for a breath and slowly release. Again, inhale, and as you exhale, tilt the pelvis back and close the gap between the back and the mat. Do not hold your breath and relax. Last time, inhale, and as you exhale, hug the belly in towards the spine. Here, you should also try to engage your pelvic floor muscles by pulling them up and in towards the navel. Slowly release. Pelvic tilts are great for strengthening the abdomen and releasing the lower back. You can do 3 sets of 10 rounds each. The next exercise is the bridge pose. Staying in this position, take a deep breath in. As you exhale, press the lower back into the floor and then press into the feet to start lifting your hips up to come into the bridge pose. Stay here for 1 breath, keeping the core engaged. Slowly come down to bring your upper back, the middle, lower back, and finally the hips on the mat. Let's do 1 more. Inhale, and as you exhale, press into the mat and raise the hips up. Make sure your knees stay parallel to each other and are not falling out. Slowly come down. You can do about 10 rounds of these. Bridge pose is great for strengthening the back, glutes, and the thighs. The next is cat-cow stretch. Come to a tabletop position with wrists under the shoulders and knees below the hips. Try to maintain a neutral spine by pulling your belly in. Look forward. As you inhale, slowly extend the spine to look up. As you exhale, curl your spine, hug your baby in, and look towards the navel. Focus on rounding and stretching the back. Again, inhale, extend up. Do not extend the lower back too much here, as during pregnancy, we are already arching the back a lot. Exhale, curl down. Let's do 1 more. Keep your neck long and shoulders away from the neck. And come to neutral. You can do about 10 to 15 of these stretches every day to mobilize the spine and the pelvis. You can also do these on a birthing ball. So you sit on the birthing ball with knees wide open and thighs parallel to the floor. As you inhale, you roll forward and extend up. As you exhale, you roll back and curl the spine. Again, inhale, roll forward. Exhale, roll back. You can also do these side to side for pelvis mobility. I have shown how to use a birthing ball during pregnancy in a separate video, the link to which is above. The next exercise is called the bird dog. Stay in tabletop position. Keep your back neutral by tucking the tailbone and hugging the baby in. Take a breath in, and as you exhale, engage your core and lift the left arm and the right leg to bring them parallel to the floor. Inhale, come back. Exhale, raise the right arm and the left leg. Inhale, come back. Work in slow controlled motion. Make sure your back and pelvis are not getting tilted to one side. Also make sure that you are not arching your back. Keep the back flat by pulling the navel in. If you're finding balancing difficult, you can do one hand and one leg at a time till you gain more balance and core strength. Bird dog works both on the abdomen and the back muscles. You can do 3 sets of these of 10 rounds each. Last exercise is the wall squats. Stand close to a wall, then keeping your feet about 6 inches away from the wall, lean your back onto the wall. Take a breath in, and as you exhale, close the gap between your back and the wall by pulling the navel in towards the spine. Take a breath in, and as you exhale, bend your knees as if sitting on a chair. You can adjust your feet forward so that your knees stay stacked over the ankles. Ensure there is still no gap between the lower back and the wall. Keep the core engaged and stay here for 3 deep breaths. Bring the hands to the wall and push into the ground to come up. Wall squats are great for activating the deep core muscles during pregnancy without putting too much pressure on the abdomen. You can do about 3 sets of 5 each.
Lastly, another essential exercise that I have not mentioned here are Kegels, which are basically exercises for your pelvic floor muscles to strengthen them to prevent issues like incontinence during pregnancy and postpartum, and they also help you have better control during labor. The reason for this is I have done a whole another video specifically for Kegels, since it's essential that we do them correctly and we start doing them early on in the pregnancy. I hope you found this video useful and it will help you have a better pregnancy experience. Do mention in the comments what other videos you would like me to cover. I'll see you with a new video soon. Till then, bye-bye.